So we'll take and look at this lung model, which is going to take and allow us to see the position of the heart in the thorax and how it favors the left side, and will result in the left lung taking and only having 2 lobes and having a notch cut out, which is termed the cardiac notch, and that on the other side we're going to have 3 lobes. When we take this and do a coronal section, we're again being aware of the 3 lobes. On the other side, they have left this more 3-dimensional so that we can see part of the tree that is referred to as the respiratory tree. So we see the trachea coming down, bifurcating, making its move toward the respective lungs. So we have the 2 primary, a right primary bronchus and a left primary bronchus. We want to realize that that's not a even division, and because the heart favors the left side, this is leaving the trachea and is a more acute angle, where the right primary bronchus is straighter with the course of the trachea. And as I reminded you, when one looks for the possibility of an inhaled foreign object, one typically scopes the right side because gravity is going to tend to move it into that. Then we look for the branching that will take us to the lobes of the respective lungs. So being the right with 3 lobes, we expect to see and do see the 3 secondary bronchi. We had 2 lobes over on the other side, so we see the 2 secondary bronchi. When we move out into this lung, they're indicating that these last divisions that we see would actually be the divisions that are considered tertiary bronchi. So this is the last level that we see with the naked eye before we go into multiple smaller branches and end up ultimately very microscopic down at the alveoli. Okay, the defined area by the white here, that is the inlet for the bronchi and for the exit and entrance of arteries and veins, is called the hilus or hilum. And the inferior portion of the thorax is taken and separated from the underlying abdominal cavity by the diaphragm. And the diaphragm has a central tendon we see in white, and so when it contracts, it takes and flattens this upside down bowl into more of a platter position when the phrenic nerve delivers its impulses, and we were under the influence of an inspiration or inhalation.